Can a nurse truly care for a patient if they don't understand their culture? In a world where healthcare workers are faced with people from every corner of the globe, it's not enough to just treat symptoms without understanding cultural values. We risk missing critical aspects of care, or worse, causing harm. There are unspoken rules, beliefs, practices, and fears that comes with every patient, and the healthcare system doesn't always prepare us for the complexity. So how do we bridge this gap? Here's what I have learned with over 20 years of work in the healthcare sector. Working in healthcare today means encountering patients from an array of cultural backgrounds. You might go from treating someone who speaks no English to someone whose religious beliefs influence the kind of treatment they would accept. And it's not just about language or religion. It's about understanding the full scope of what culture means in a medical context. It influences how people perceive health, illness, and even death. And for me, this became clear early in my career. One of my first encounters with cultural differences came during a night shift in the ED. A young woman was brought in with severe abdominal pain. She was Middle Eastern and her husband acted as her interpreter. As we moved forward with the treatment, it became clear that she was hesitant to accept certain procedures. Her husband explained that their culture and religious belief made it difficult for her to be examined by a male doctor. And it was in that moment I realized that while I had focused on the medical aspect, I had overlooked an essential part of her care, her cultural comfort. It was a humbling experience, but it also taught me the importance of listening beyond what is spoken. And here I want to point out that Medaleini Leninger, a key nurse theorist, stresses this in her theory of transcultural nursing. Leninger believed that providing cultural congruent care is one of the most critical aspects of nursing today. Her theory is all about understanding cultural differences and integrating that understanding into patient care, making sure that care fits into the cultural context of the patient. It is not about imposing one standard of care. It's about adjusting the standard to respect the patient's beliefs in another situation. I worked with a family from a Southeastern Asian country who had brought their elderly father in with a stroke. They had a very specific idea about his care. They wanted to include traditional herbal remedies along with his prescribed medication. And at first, I didn't know how to respond. But instead of dismissing their requests, I took the time to talk to them about it, understanding their need to hold on to their cultural practices, even in a clinical setting. We collaborated discussing which herbs could be safely incorporated into his treatment without interfering with the prescribed drugs. It wasn't about compromising medical care. It was about showing respect for their cultural values while ensuring the best outcome for the patient. And that is what nursing in a multicultural setting is all about. Finding the balance between clinical care and cultural sensitivity.
How is that possible?
We are not just treating the body, we are caring for the whole person, and that person's identity is shaped by their culture. This can be something as small as adjusting a dietary plan for religious reason, or as significant as modifying end-of-life care to align with the patient's cultural beliefs. One of the most memorable cases I have ever been involved in was a Latin American family whose daughter was terminally ill. They were very religious and believed strongly in miracles. They were hopeful that she would recover even when the prognosis wasn't good. This was a tough situation. How do you balance the medical reality with the family's hope? In situations like this, the nurse becomes more than just a caregiver. You become a cultural mediator. And again, I thought of Leninger's work, where she emphasizes the importance of being an advocate for culturally competent care, even in difficult situations. I couldn't change their beliefs in miracles, and I wasn't there to challenge it. Instead, I focused on providing the best possible care while respecting their hope, ensuring that every step of the process honored their beliefs. By doing this, I found a way to connect with the family, gaining their trust and making the end-of-life care more manageable for everyone involved. And one of the things that stuck with me was, as religious people believing in the Catholic Church, I went out and spoke to a Catholic minister. I myself is from a Catholic family. I'm not Catholic, but my family is. So I know a bit about it, and I reached out to the minister. I said, "Oh right, I have this patient who has another belief in the same church as my family does. So I want to understand," and we had a long talk about it. And that is why we should not forget about communication, which is often the most immediate and noticeable barrier in a multicultural setting. It's not always about speaking different languages. It's also about the way information is conveyed and received. I once cared for a patient who spoke limited Danish and came from a rural part of Africa. Every time I asked him how he was feeling, he would nod and smile and roll, even though his vitals were showing signs of distress. Eventually, I realized that in his culture, expressing pain openly was seen as a sign of weakness. It wasn't that he didn't understand me. It was that he didn't feel comfortable showing vulnerability in a way that I was accustomed to seeing. This changed how I approached communication with him, making sure that I asked more specific questions and read his body language closely. And the theory of intercultural communication, which focuses on how cultural differences shape the way we interact, was something that played a role in this situation. In nursing, understanding these subtle communication differences can make all the difference in a patient's outcome, and this is even when a language barrier exists. There are ways to build trust and ensuring understanding, whether that is through using interpreters, gestures, or simply giving more time for the patient to respond in a way they are comfortable with. And Florence Nightingale, often seen as the founder of modern nursing, might not have explicitly talked about cultural diversity, but her emphasis on individualized patient care was far ahead of her time. In her writings, she stressed the importance of tailoring care to each patient's unique situation, and it's something that rings true in a multicultural healthcare setting. In a way, she laid the foundation for theories like Leninger, which have evolved to meet the demands of today's culturally complex world. One time, I found myself treating a patient from an indigenous community. He was reserved, keeping his distance and not engaging with the medical team. His family also had a hands-off approach, which initially seemed like a lack of interest in his care. But as I spent more time with them, I learned that their culture highly values privacy and autonomy, especially in medical decisions. It wasn't that they didn't understand, it was just their way of doing life. They didn't want to interfere, not because they didn't care, but because they respected his right to make decisions for himself. Once I understood this, it changed the way I interacted with him. This allowed him to open up in his own time, leading to a better communication and trust. Culturally competent care doesn't mean knowing every detail of every culture you encounter. That's simply impossible. What it does mean is being open to learning, listening, and respecting the differences that makes each patient unique. It's about recognizing when your approach isn't working, not because the patient doesn't understand, but because the cultural context hasn't been taken into account. This isn't just good practice, it's essential to being a good nurse. And one of my mentors once told me that nursing is 10% science and 90% communication. And in a multicultural setting, this becomes even more evident. Science is universal, but the way people respond to it is deeply personal and cultural. Whether it's how they interpret symptoms, their fears about treatment, or their expectations of recovery. Culture shapes every aspect of healthcare. As a nurse, it is our responsibility to bridge the gap between the science we know and the cultural beliefs of our patients. Sometimes this is a delicate balance, but what makes nursing so unique, it's not just about following protocols, it's about understanding the human behind the illness. And in a world that is growing more diverse day by day, nursing in multicultural setting isn't just a skill, it's a necessity. It requires more than just clinical knowledge, it demands empathy, communication, and willingness to understand people on their own terms. This is the challenge we face, and it's one of the most rewarding parts of the job. Caring for patients across cultures isn't just about treating their bodies, it's about understanding their minds and respecting their hearts. And if you want to be smarter on nursing, healthcare, and other health-related questions, then check out this video YouTube has picked specially for you. And I'll be looking forward to seeing you over there, where I can show you some more interesting thing about health, healthcare, and nursing.